Hi everyone, welcome to Webinar Wednesday. I am your host, Kia, and I want to thank you all for joining us today. Today's speaker is Dr. Segal, and she is going to discuss the importance of knowing your numbers, the leading factors of disease, and how you can prevent illnesses. Dr. Segal is a board certified in family medicine, and she practices at our downtown at the Shops Clinic location. As a reminder, we will be taking any questions you have at the end of the presentation. If a question happens to pop up, just type it in your question box and we will do our best to address it at the end of the presentation. With that being said, I will pass everything over to Dr. Segal.
Good afternoon, everyone. Welcome to the Wednesday webinar. Today we are going to talk about preventive medicine. Prevention in medicine is very, very important. Prevention basically means an act or practice of keeping something from happening. Why do we care about prevention? You know, all of us, when we want to see a doctor, we want to first make sure that we really never have to see a doctor. We don't want any disease to happen. But in case we ever get sick, we want to treat it as soon as possible. Most of the doctors are attracted to medicine because they look forward to curing disease. However, from a patient perspective, as I said, a patient never wants a disease, and if at all he or she cannot avoid an illness, he or she would want that we should be able to stamp it out before it can cause any harm. So this is why prevention is important. In our webinar today, we are going to focus on why prevention is important. I am going to touch on your risks. We will talk about your numbers, understanding your body mass index. Then I'm going to talk a little bit about leading factors of the disease. I will talk about high cholesterol and high blood pressure and what as a person we can do to improve our health with diet, exercise, and sleep. The good news about preventative medicine is that you are more likely to catch a preventable disease early at a more manageable state. There are fewer emergency department visits and hospital admissions. Your health stays on track and your doctor is able to benchmark and keep track of your numbers at every visit. Preventive care constitutes a large portion of clinical practice and is incorporated in the ongoing care of our patients. For example, at our clinic, we check your blood pressure at every visit. We offer you immunizations. These are very good examples of preventive medicine. If from a physician perspective, you look at preventative medicine or preventative care, it could be broadly categorized into primary prevention, secondary prevention, and tertiary prevention. So primary prevention basically means that you want to keep a disease from occurring by removing its causes. The best example is immunizations and behavioral counseling. We give you certain vaccines so that you never get a certain kind of disease. Think of childhood vaccines, and now we offer adult vaccines. And this is very, very important primary prevention. Secondary prevention means you want to diagnose a disease early on when it's asymptomatic and treat it so that the treatment can stop it from progression. Example would be doing a pap smear to catch certain changes in your cervix early on at a precancerous level and treat it so that you do not get a cervical cancer. Another example of secondary prevention would be checking your asymptomatic people for HIV so that if you detect it, you could really treat it. Then there's another kind of prevention which is called tertiary prevention. Tertiary prevention basically means there are certain activities you would do when a disease is already there so that you can ward off the complications of the disease. Example would be in a diabetic patient, we want them to go see their eye doctors so that they do not have eye problems. we put them on statins so that it will decrease the risk of heart disease. So in the tertiary prevention, the disease is already there. We just want to protect you from the complications. So these are different kinds of prevention we do as physicians. Now, what can you as a patient do? Your job is to make sure that you first of all choose a primary care prevention. In our Kelsey-Seybold clinic, we have huge family medicine and internal medicine departments for adult primary care physicians, and we have pediatricians for our younger patients. So all of you should first choose a primary care physician. And then once you start establishing a relationship with your physician, you go and see them regularly. You basically check your numbers. We check your cholesterol, your blood pressure, your weight, your height, and all those things are measured on a regular basis. You should try to get an annual physical. Try to eat healthy. Exercise regularly. Try to quit smoking if you smoke, and get adequate sleep. When you know your numbers today, you have the power to achieve a healthier tomorrow. You know, we have all heard about ounce of prevention. This serves as an early warning system. Preventative medicine evaluates your risk of developing a chronic illness in future. Assess the progression of a disease in patients. It also analyzes the impact of chronic illnesses, and it provides a tool to help improve your overall health. A lot of studies have been done that have shown that patients or people who have visits to regular visits to their primary care physicians are more likely to undergo screening for colorectal cancer and breast cancer, and they have lower incidence of mortality from these cancers, and overall visits to their primary care physicians decreases their overall mortality or risk of dying. This is very, very important. So when you come to your physician visits, your physicians, you know, not only just ask you to do annual physicals, they also basically take care of all other problems as you see them. Example would be if you are seeing your doctor for a cold, the doctor may talk to you about other preventative measures like, you know, you are due for certain vaccines or you are due for your mammogram. At Kelsey, in our EPIC system, we have what we call best practice alerts. So these tell physicians if a patient is required to do a certain health maintenance at that visit. So you don't necessarily have to wait for an annual physical. We offer you all these screenings as we go. Now, talking about your preventative medicine, we are first going to touch on your body mass index. Body mass index, or BMI, is a number that is calculated from a person's weight and height. It provides a reliable indicator of body fatness for most sedentary people, and it's used to screen for weight categories that may lead to health problems. It is basically a first step to determine the degree of fatness in the body, and it's easy to measure and a very reliable indicator. So now, based off on your BMI, we categorize people into being overweight or obese or normal weight for their height. An example is somebody who's 5 feet and 9 inches. If that person weighs 124 pounds or less, so BMI is less than 18.5, that person is considered underweight for his height. Whereas if the weight is 125 to 168, you can see this is considered healthy weight. If you are beyond 169 pounds but still less than 202 pounds, you are considered overweight for your height because your body mass index is over 25, less than 29.9. If your body mass index is more than 30, you are considered obese, and if your body mass index is more than 40, you are considered morbidly obese. These are the people who now, because of their weight alone, are considered high risk for all kinds of diseases, chronic illnesses like heart disease, high blood pressure, and diabetes. Body composition is another measure that is used. We have fat calipers at some of our clinics, and we can do the body fat percentage in some patients. This is really not as reliable an indicator as I would say BMI is. However, just for your knowledge, in women and men, fat percentages are different. Acceptable fat percentage in women is 25 to 31%, wherein in men it's slightly lower, 18 to 25%. If you're really very athletic, this fat percentage is much lower. You know, when we use these calipers, we have a cheat sheet that we look at, and we also go by your gender and by age. So as you grow older, you could have a little bit more fat, but when you're younger, the criteria is very, very strict. I do not pay much attention to body fat percentage. Some people ask for it and will do it, but this is not a regular thing that we do usually with your physicals or with your regular appointments. Another very valid measure of your body fatness is waist circumference, or checking your abdominal obesity. This is really important because for people who are categorized as overweight by their BMI, they should get their waist circumference. For a man, a healthy waist circumference is considered less than 40 inches, and for a non-pregnant female, a healthy waist circumference is less than 35 inches. Remember, these measurements are for Caucasians and African American ethnicities. Studies have shown that Asians, especially South Asians, their measurement should be a slightly lower than that. And in Asian Americans especially, for a man, the healthy waist circumference should be less than 35, and for a woman, it has to be less than 31 inches. Just a little bit of an ethnic variation here. So what does it tell you basically? You know, excessive abdominal fat means you are at greater risk of type 2 diabetes, high blood cholesterol, high triglycerides, high blood pressure, and eventually coronary artery disease or heart disease. You know, just to let you know, we believe that apple-shaped bodies, that means more abdominal girth, is a higher risk factor for heart disease in future compared to a pear-shaped bodies where you will have more fat around the buttock area. Now, why do we care about weight? We care about obesity because it is linked to a lot of other diseases. Being obese means you are now at increased risk of coronary heart disease, hypertension, diabetes, sleep apnea, osteoarthritis, stroke, and breast and colon cancer. This is very, very important. Think, just being overweight and obese is now increasing your risk of certain cancers, which can really be prevented to some extent by losing weight or by being in the right weight for your height. Now we are going to touch a little bit on the leading factors of disease. We are going to start off with talking about cholesterol. Cholesterol is a waxy, fat-like substance which is made by the body, and it is also found in certain foods that we eat. 75% of cholesterol that circulates in our blood is basically produced by liver. Only 25 to 30% of cholesterol comes from what we eat. We need a certain amount of cholesterol because body functions properly, and cholesterol is required for building our cell membranes. So we do need some cholesterol. The problem is too much cholesterol, because when we have too much cholesterol in our blood, it starts causing clogs or plaques in our arteries. Testing cholesterol is very easy and very, very important. The lab test for checking cholesterol is called lipid profile. The recommendations are to start testing it between the age of 18 to 20 years, and it is also based on your initial level and risk factors. And after that, the frequency can vary considerably. Not everybody needs to check it, but if you do check it, it has to be before age 18. The results are reported as HDL, which is high density lipoprotein or good cholesterol, LDL, which is low density lipoprotein or bad cholesterol. Easy way to remember HDL and LDL is H is healthy cholesterol, so H should be high. L is lousy or bad cholesterol, and it should be low. So L should be low, H should be high. Then another kind of cholesterol is VLDL, which is very low density lipoprotein. Then triglycerides are checked, which are a type of fat carried in the blood and stored in the fat cells. It's also a kind of a bad fat. We look at your total cholesterol, which is a combination of different types of cholesterol. And then we measure your cholesterol ratio, which is your total cholesterol number divided by your HDL or good cholesterol. Now we are going to switch gears to blood pressure. Blood pressure is generated in the arteries when the heart pumps. When your heart beats, certain pressure to push blood through a network of arteries and veins is called blood pressure, and it's always recorded as two numbers. The top number is called systolic blood pressure, and the bottom number is called diastolic blood pressure. The top number, or the systolic blood pressure, is generated in the arteries when your heart beats, whereas the bottom number is generated in the arteries in between the beats when the heart relaxes. So remember, blood pressure should always be reported as top number and bottom number, and try to remember your numbers. I'm going to tell you what is your acceptable blood pressure now. So this is based off on the current guidelines, and please pay closer attention to this slide because recommendations for what is considered normal has changed. So now the normal blood pressure for the top number has to be less than 120, and the bottom number has to be less than 80, meaning if your blood pressure is in 110s and 70s, you are considered normal. Whereas if your top number is up to 129 and still less than 80, you will be now considered having pre-hypertension. And now your stage 1 hypertension is when your top number is from 130 up to 139 and your bottom number is 80 to 89. Whereas stage 2 hypertension now is any top blood pressure more than 140 and the bottom number more than 90. So remember that this is a little bit of a more stringent criteria for blood pressure, and it is a change from the previous guidelines, but this is what we go by now because studies have shown that this is what we should aim at for what is considered normal blood pressure to avoid the future risk of kidney problems and heart disease. Hypertension or high blood pressure is caused by several factors, including little or no exercise, poor diet, obesity, older age, and your genes. Some of the factors you can change, and we should really focus on the what we call modifiable risk factors. Some of the things you cannot change. Genes, ethnicity cannot be changed, so we do not pay closer attention to those things. So anybody who has blood pressure more than 140 on the top, more than 90 at the bottom, is now considered stage 2 hypertension, and these people should be on lifestyle change and maybe need medications. So you have to talk to your PCPs regarding this, and medications are given based on case-to-case basis. Everybody is different. Please talk to your primary care providers if your blood pressure stays more than 140 or 90. Other thing that I want you to understand is hypertension is a silent killer. Do not wait for symptoms. Do not tell your doctors that I know when my blood pressure is high and I feel bad. Most of us do not know when blood pressure is high. When your blood pressure is high, it's causing damage to your arteries. You don't know about that. So please periodically check your blood pressure at home, and if it's staying high, or when you see your PCP and doctor discusses with you that your blood pressure is high, please try to listen to that carefully and try to manage your blood pressure with lifestyle change and medications as recommended. Also, salt becomes a very important factor when you have high blood pressure because a lot of people are considered salt sensitive. Too much salt in your diet increases your risk of high blood pressure. Most of salt that we eat actually comes from processed foods, prepackaged foods, or foods that are prepared in the restaurants. American Heart Association recommends no more than 300 milligrams of salt each day. This turns out to be about 2 tablespoons of salt. Try to check your food labels and nutritional info on restaurant websites for salt content. Most of us usually would not cook with a lot of salt, but it's basically the packaged foods and food prepared outside that contains a lot of salt. So start paying closer attention to sodium content or the salt content of your foods. Who should really pay closer attention to this? People who are 51 years or older, African Americans, people who have high blood pressure, people who have diabetes or chronic kidney disease. All these are considered salt-sensitive people. So these groups especially have to pay more closer attention to the salt in the food. Also, do not forget to get your regular checkups. Don't miss out on your regular screenings and immunizations. Remember, as I said in the beginning of this presentation, immunizations are your most important primary prevention. Try to get all your shots, age-related shots for kids and adults are offered at Kelsey-Seybold on all your regular appointments. When a doctor discusses your immunizations with you, try to understand why they are asking you to get those shots, because these shots are important. We are trying to prevent a disease. So please do not hesitate to ask doctor about any questions or concerns you have regarding a particular vaccine, but try to get immunized against whatever we have available for your age. Healthy diet is very, very important. If you look at this plate, this comes from choosemyplate.gov website. Half of your plate should be fruits and veggies. This is a change now, and this is how our plate should look like. Choose your foods that are lower in salt and added sugar. Choose whole grains and then lean proteins. Drink water instead of any sugary drinks or alcohol with your meals. Be very mindful of your portion sizes. Eat when you're hungry and stop once you're satisfied. If you want to eat more, you can always go back for seconds, but remember, you cannot go back in time and eat less. So pay closer attention to when your body tells you that you are full now. If you are full, just stop, wait for 10 to 15 seconds, and then if you're still feeling hungry, it's okay to go for seconds. Now we are going to talk a little bit about exercise. Exercise is very important because it lowers your risk of early death, heart disease, stroke, high blood pressure, high cholesterol, type 2 diabetes, colon cancer, and breast cancer. And the benefits of exercise are basically weight management, improving your aerobic fitness and muscular strength. It also prevents falls and decreases your depression. Exercise is really important at all age groups, but I would say that for elderly people, it is very, very important because it improves their sense of balance and it does decrease their risk of falls. Aerobic activities, or what we usually call cardiovascular exercises, should be done 2 hours and 30 minutes each week. And that turns out to be about 150 minutes of your moderate intensity aerobic exercise, or 1 hour and 15 minutes, which is like 75 minutes of vigorous intensity aerobic exercise. So how would you determine whether you are doing moderate intensity or vigorous intensity? Do the talk test. If you're breathing hard enough that you could still talk, but you cannot sing, consider yourself doing a moderate intensity activity or exercise. However, if you're breathing hard enough that you could neither talk nor sing, that means you are now exercising at what is called vigorous intensity. You can start off slow and build up the intensity of your exercise. You can start off with brisk walking and then you can go on to running or swimming or biking or whatever you want to do. But remember, the recommendations are at least 30 minutes of exercise most days in a week, and that is considered being active. Muscle strengthening exercises are also very, very important. If you start doing these muscle strengthening exercises, try to work on at least 2 major muscle groups, and recommendation is basically doing it 2 or 3 days a week. Start off with legs or hips, then you can work on your back and abdomen. You can do your chest, shoulders, or arms. So you could do all of these muscle groups in one day, or you could break up in different sessions. It's up to you. By end of each of these exercises, your muscles should feel tired, but not in pain. If your muscles do not feel tired, then that means you need to increase the weight or resistance that you're using. Then talking about smoking cessation. there is no benefit of smoking. Nicotine in your cigarettes is considered a carcinogen. Smoking causes direct damage to the blood vessels and it blocks the critical arteries near the heart. If you are a smoker or you know somebody who's a smoker, the best thing to do is to quit smoking. Secondhand smoking is also very injurious. It exposes your heart. It increases your risk of heart disease and lung cancer. Non-smokers who are exposed to secondhand smoke at home or at work increase their risk of heart disease by up to 30% and their risk of lung cancer by 20 to 30%. Breathing secondhand smoke has immediate harmful effects on your heart or cardiovascular system, and it in turn increases your risk of heart attack. People who are already having a heart disease, they are particularly at a higher risk by secondhand smoke. Please make sure that you quit smoking, or if you have any loved one who smokes, try to talk them out of this bad habit. Talking about sleep. Sleep is essential for your good health, your mental and emotional function. It also boosts your immunity and it consolidates your memories. So sleep is not just an inert activity. A lot of your body processes are active. So it is very, very important for us to get good sleep. So this is a huge question. How much sleep do we actually need? National Sleep Foundation consensus report says most adults would need about 7 to 9 hours of sleep. The number of hours of sleep that an adult needs to feel rested, it's really not set in stone. Different organizations have come up with a number. They say adults between 7 to 9 hours. Children and elderly may need more sleep. Amount of sleep that you need is as much as it takes for you to feel rested in the morning. I think this brings us to the end of this webinar, and I'm open to any questions. Before I do that, I would like to thank all of you for listening to this. Preventative care, as I said, is a very important part of healthcare now. All of you listeners, please choose a primary care doctor. Take advantage of all the primary care doctors in family medicine and internal medicine that we have, and try to see your PCPs regularly. Thank you so much. All right, I'm going to get to some of your interesting questions. Question I see is, can your PCP deny you getting a preventative exam? I don't think so. I would not see any reason why should your PCP tell you that you don't need a preventative exam. I think when you say preventative exam, you're talking about an annual physical. A lot of times, if your PCP is already doing all the health maintenance screenings with your regular visits, which may not be considered physical, then you may not really need a total annual physical if you have done all the screenings. But I don't think any doctor should ever deny you any preventative health screenings. Then another question is, my body mass index is 34. I walk regularly trying to get about 6,000 steps. I diet too. How can I lose weight? For somebody like you, I would really want to increase the intensity of your exercise. That means just walking is not going to help, and pay closer attention to your diet. You need to put in less calories. You may start off with seeing a dietitian. If you're really trying to lose weight seriously, you will have to make some serious changes to your diet. We should try to lose weight by putting in less calories, Exercise does not let you lose a lot of weight, but what exercise does is tone your muscles, increase your stamina, and maintain the loss that you attain by eating right. So a combination of low calorie diet and exercise is important for losing weight. Start off with seeing your dietitian. You can even talk to your primary care doctor, and I don't see any reason why you should not be able to attain your desirable weight. Another question is, how often do you suggest seeing your PCP? Now, this is a very broad question. It actually depends on your age. It also depends on your risk factors. At a minimum, you should see your PCP annually, means once a year, for your general preventative health exam, health maintenance exam, or what we call physical. But if you have anything else, or based off on your risk factors, your ethnicity or family history, you may need to see your doctor more. Example would be during an annual physical, if your doctor comes up with your that you have high blood pressure, or you have high cholesterol, or you are now pre-diabetic or something like that, then you may have to see your doctor more often for follow-ups. But at a minimum, I would say once a year for everyone. Then the another question is, can we get a copy of this presentation? I would ask Kia for that. Okay, I did ask Kia from marketing. She says, send me your email address and you can get a copy of this presentation. Okay, now another interesting question is there another alternative to bringing my cholesterol down? When I take my medicine, it makes my joints hurt. You know, when you take the cholesterol lowering medications, they actually decrease the production of cholesterol, which I said in the presentation is the major contributor to your cholesterol. Yes, some cholesterol medicines do make your joints or muscles ache, but there are certain other alternatives. Talk to your primary care provider. But do not forget, 25% of this cholesterol is what you eat. So you may need to go on very low fat diet and low cholesterol diet. So meaning eat more fresh fruits and veggies and cut down on a lot of processed foods and animal fats that come from your butter and lard. And talk to your doctor. If your cholesterol is really high and it really warrants a medical treatment, then you may need to go to an alternative group of medications. And then another question is, what kind of visit should you ask for when you're trying to lose weight? I think it could be a simple office visit. You are just basically trying to discuss your weight with your physician, and this is like a regular office visit in my mind. Patients come to us all the time trying to discuss their weight, and they want recommendations for trying to, become healthier and lose weight. Another interesting question I see is, do you have any recommendations on trying to get better sleep? I could give you a little, common things that we should all do. First of all, you should have a regular sleep and wake cycle, meaning set up a bedtime routine. Every day of the week, including the weekends, try to get to bed at the same time and try to wake up at the same time. Try not to get any naps during the daytime. And if you really want a power nap, it should really be less than 20 minutes. Try to stay away from caffeine or eating heavier meals at night. Try to minimize all kinds of noises and lights in your bedroom. Whenever it's your bedtime, 30 minutes before the bedtime, try to wind down. So in my mind, getting to sleep is also a very important chore. So, minimize like all kinds of sounds. Do not check your emails. Do not look at your cell phone. Switch off your cell phone or put it at a vibration. Try to minimize all kinds of interruptions, and then in a dark room, you try to go to sleep.
Okay, so we're going to answer one more question. Go ahead, Dr.
Okay, another good question is, what type of diet should I follow if I have high blood pressure? You should really follow what we call a low salt diet. Another good diet is what I call DASH diet. So it DASH stands for Dietary Approaches to Stop Hypertension. It's basically close to Mediterranean diet. It focuses more on fresh fruits, vegetables, low-fat dairy, and some meats. You could Google it. You can send me your email, and I can send you handouts on DASH diet if you want. But really, salt should be very less. If you really have high blood pressure and you're salt sensitive, try to cut down your salt to less than 2,000 milligram a day. Look for the sodium on the labels, and sodium is salt, so try to cut down on that. And then another question is, I am currently, and this is my last question that I can take, I am currently on blood pressure medications. Will losing weight help me to be able to discontinue it? You know what? I do not have a very good answer for that, and I say that because blood pressure is multifactorial. It helps you a lot to lose your weight, but because it not only decreases your blood pressure to some extent, it also makes you healthier, and it decreases the risk of certain cancers and heart disease in future. But just by losing weight, I cannot promise that you would be able to come off of your blood pressure medications. So please talk to your doctor, work with your primary care physician closely, and monitor your numbers very, very close. You know, there are many people who are able to get off their blood pressure medications if their numbers stay normal due to their lifestyle changes. So if you are one of them, good luck. Thank you so much.
All right, we just received a quick lesson about the importance of preventative health exams. This includes our webinar. I want to especially thank Dr. Segal for doing an incredible job today. And I also want to thank you all for joining us this month. Please make sure to register for next month's webinar if you haven't already. And that will be with Dr. Shane McGee at our Tanglewood location, and that'll be over supplements. We'll see you guys next month. Thanks.